Welcome to the American Shoulder and Elbow Surgeons Podcast. I'm your host, Peter Chalmers, a shoulder and elbow surgeon at the University of Utah in Salt Lake City. Before we get started, I should mention that the views expressed in the podcast do not necessarily reflect the views of the American Shoulder and Elbow Surgeons Society, the University of Utah, the University of any of our guests. Today, we're going to talk about National Shoulder and Elbow Week. And to discuss, we have Dr. Anthony Miniaci as a guest. Dr. Miniaci is at the Cleveland Clinic, and he also serves as the chair of the American Shoulder and Elbow Surgeons Foundation. Dr. Miniaci, welcome to the podcast.
Thanks, Peter. It's really an honor and a pleasure to be here with you today.
Well, I think I speak on behalf of all of our membership when I say thank you for your service leading our foundation. Tell us a little bit about how National Shoulder and Elbow Week, how did this come about? How does it fit into your plans for the foundation?
Yeah, so it has gradually evolved with the work of a number of people at the foundation over the last number of years. And the whole idea was we tried to figure out, who the foundation was, what we were trying to do, and how we were going to get there. And one of the things we realized that we have multiple constituencies. We have our members, obviously, which we all understand, and we have our strategic partners. But we also have a large constituency of patients who come to us for their care, and we take care of them, but are also interested in some of the things we do in research and education and in the betterment of their outcomes for care. So that we wanted to do something which brought all of those constituencies together. So that we wanted to bring our strategic partners, our members, and our patients and personnel involved in providing shoulder and elbow care, and put them in one place so that we could celebrate their care, celebrate the past research and successes, and as well support some of the new things coming forward. So we thought that setting up a National Shoulder and Elbow Week to celebrate that would be a good idea. And what we'd like to do is really reach out into the community of shoulder and elbow surgeons out there who are members of ASES, but also reach out to the people that they treat, to the personnel that they're involved with, and bring them together in those communities to celebrate this and to fundraise to help with this. And so that a lot of the initiatives that we're doing really will go back to help some of those communities, so that the funds that are raised will be useful for things like educational initiatives, research initiatives, or anything that improves patient outcomes in that community, and that those people who organize these events can apply for some of those funds through the ASES Foundation.
I love the way that you frame it as both the way that we can celebrate what we've accomplished then, and also to fundraise so that we can in the future maybe reach even greater heights. Tell us about some of the ways you picture us celebrating our accomplishments, or maybe some of the things that in the past we've really helped people with.
Well, so, I have been a shoulder and elbow surgeon now for greater than 25 years. And I can tell you that some of the things that I do today weren't even around when I started my practice and training during my fellowship. So, just one example is reverse shoulder arthroplasty. Back 20 years ago, when it was being done in Europe and not even being done in North America, we didn't have that option for a lot of complex problems. And now we're to the point where it's become a very accepted, and the research been done has been fantastic. And we're learning more and more about how to treat those kind of patients. So we have a solution now for a problem that we didn't know how to treat 20 years ago. So that's sort of one of the examples. And then, there's also some of the things that we're very proud of at ASES. We've established many multi-center groups to answer certain problems in arthritis in young patients, in infections in joints. And we're all working collectively towards this, but those type of studies, which require multiple centers and a lot of individuals, require a lot of funding. And so some of the funds we're trying to raise are to support some of those multi-center trials amongst all of our colleagues to improve patient care, obviously.
Yeah, I think that's just a great example of something the ASES is doing that's really helped. So, for instance, we had Andy Jawa on the on the podcast just recently, and he was telling us about the ways in which the findings from his multi-center study on acromial fractures that he arranged through the ASES and how that changed his practice and changed his thinking about that important complication of reverse total shoulder arthroplasty. You mentioned that these are funds that can be applied for the future.
Yeah.
Certainly, would this support things like the NEAR Award or the Rockwood Award, or are these even new grants and new funding initiatives?
Yeah, so those are existing grants that we have for our members for things. And so the whole idea behind this is to really reach out to the community. I didn't want this to be just specific grants that only a few people can get to. I want this to be able to reach out to our community of surgeons and patients and healthcare personnel out there, so that if they work, they do the stuff, they can see the money come back into their communities, so that perhaps I need something in my center that I can't get, whether it's related to patient outcomes or whether it's a research personnel or whether it's an educational event that would help. If I organize something in my center, I would like to be able to get some of those funds. And so that I really would like for the community of orthopedic shoulder and elbow surgeons to benefit from this type of event, and have the patients who come to these events locally see that their generosities, their involvement actually comes back to help their local.
So now tell us what week of the year is Shoulder and Elbow Week, and how are we organizing this year? I know it's a new thing.
Yeah, so yeah, and thanks very much for inviting us, because this is the first time this is ever being done, so that whenever you do something new, you're always nervous about how things are going off. So that we decided that we were going to do this slowly. We have 5 sites, and we have some great local organizing committees. This year, it's going to be the 3rd week of September. Every year will be National Shoulder and Elbow Week. Okay, so that this year we decided on 5 sites, and it's going to be Tampa, Atlanta, Nashville, Philadelphia, and San Francisco. Now, the beautiful thing about this is that, like I said, I wanted this to be inclusive and bringing our communities of surgeons and patients together, so that these are nonpartisan, so that in each of the centers you have surgeons working even at competing institutions working together to organize these events. And what we're doing is that each of the local events are doing something totally different. So I know that in Nashville they're doing a bourbon whiskey tasting event. I know that in San Francisco they have something at the Yacht Club on the Water with some wine tasting, and so that each site has decided to do a local flavor for their event. And any of the funds that are raised obviously come through the foundation, but then those individuals that have been involved in organizing and participating in that local event then can apply for loans. And we've encouraged not only the shoulder and elbow surgeons, but also the healthcare personnel, so that the therapists, the nurses that they work with, to be involved in these events, as well as their patients, bringing their patients to these events. We want everybody to be involved. And then we've asked for support and involvement from our strategic partners as well.
I love that each different place is doing their own little thing,
Yes.
their own little local flavor. Tell us a little bit now. What does the future hold? What if that's this year? How do we take that and then make that into next year?
So, like I said, this is our first year, so that we're being fairly conservative. Wanted to start. We felt 5 sites was manageable, because obviously, whenever you do something new, you're going to learn a lot about the process, and hopefully, we don't make too many mistakes. But for sure, we're going to learn some things that are very good and some things that are maybe not so good, so that we can learn for future years. But I can tell you, the excitement amongst our members is huge. We already have. We decided to double it for next year, so that there will be 10 sites. And we already had people lined up to wanting to do those at different, so we'll have another 5 different cities next year. And hopefully over time, any community of shoulder and elbow surgeons and patients and partners can hold this in their own city during that 3rd week of September.
So, if people want to get involved, who do they contact? Do they contact you? Should they contact Steve with the ASES? What's the best way to get involved if someone says this sounds like a great idea and I want to be part of it?
Yeah, so we contacting the American Shoulder and Elbow Surgeons Foundation, the ASES Foundation, and Steve Molodoc works there as well. But we've also hired. We've had so much activity in the foundation over the last couple years that we also have now a designated person with the foundation. Her name is Rosanna Kishito. So she works for the ASES Foundation. And so that giving her a call, or I'm open. Anybody that's interested in being involved, please send me an email or give me a call. I'm happy to get them in the right direction.
Well, this is such a cool thing that you're doing to raise awareness, and such a cool thing to celebrate everything we've done together to to improve the care of our patients and to drive our field forward. I think it's one of the things that I think all of us love about the ASES is that it has such a collegial atmosphere for all of us to work together to build towards a better future. So tell us a little bit, what other initiatives do you have going on in the foundation? Anything else you'd like to tell us about the foundation is working on?
Yeah, I'd love to. So that, like I mentioned at the beginning, we sat back and we analyzed, who are our constituents and what are the things we need to do to help those constituencies in understanding what we do and support some of our initiatives. Okay, so that our overall mission is to support our educational and research goals, but also some of these patient-centered type of things. So that what we did was, a couple of years ago, when I took over as chair of the foundation, we had about 8 people who were involved with organizing these things. And so that one of the things that we wanted to do was reach out to the community of our membership to say, you know what, this is your foundation, this is your society. Let's get everybody involved. So we actually now have over 50 people involved in different committees that are working on different initiatives. So we have a committee which is involved with our strategic partners, which is sort of our traditional way of trying to raise funds for some of these activities. And but what we've done is that we've taken a different approach as opposed to just asking for funds. We've actually given our strategic partners the opportunity to tell us what they would like to see happen with their monies if they were to get involved with some philanthropic activities of the ASES Foundation. And so we have a whole committee related to that, and we've met with a number of our partners, and we have a lot of exciting things that are coming to fruition with that, and some major gifts from some of the companies that are coming. So the second constituency, obviously, is our membership. And although in the past we've had some generosity from some of our members, what I wanted to do was get everybody involved with this, so that and get everybody involved in a different way. So I'd like to see, eventually I'd like to see almost 100% participation, so that, not everybody can afford to give large amounts at once, but, I'm trying to sort of find ways to be able to donate small amounts, weekly, monthly basis, so that you can help in a lot of different initiatives. So that one of the things that I wanted to do through the membership committee, so we have a membership-centered committee as well, is to set up something called the Legacy Fund. And so that I thought that it would be wonderful if we honored our founders. So the ASES was founded by a number of members. And so you can find this on our website. So the foundation, so we've revamped our website. You can actually go and see who our founders were. And so that if you donate, you can actually donate in the name of one of your founders, because a lot of these guys actually either trained us or trained somebody who trained us. And and a lot of people are very interested in donating in their names, so that we already have a lot of activity on that front, so that you donate to an overall legacy fund, but in the name of somebody who may have trained you, who was one of the founders of the society. So you can actually go and find out who all these founders were, and you can actually donate in their names. And those are unrestricted funds, and they will always be those funds will be there in perpetuity. We're only going to use them, the interest that's raised from those funds, so that those funds will live in perpetuity. And then finally, we have this patient-centered group, which is organizing this activity, which is a big, tall order over the last couple of years getting this organized, just to engage more our patients, to understand, their successes, what they want, what they do, so that if you actually go to the website now, you'll see that there's a lot of things that we've added to the website which are involved with education of patients in terms of rehab protocols, different types of surgical procedures that they may not have heard of or not know of, different patient stories on that site, and give them also the opportunity to be involved in that philanthropic process if they feel that they'd like to do so.
Just to harken back, if you're listening and there's someone you'd like, the list of people on this founders list is incredible. Louis Bigliani, Rich Hawkins, Robert Neviser, Melvin Post, Robert Samuelson, Russell Wow. There's a huge list of giants within our field that you can then go on and say, as a token of that, something that person taught me at some point along the way, you could give to that fund. So I think that's a phenomenal idea, to really feel like you're giving in honor of someone that you really want to honor. Well, anything else you'd like to add about what the foundation is doing? Anything else you'd like our members to know about your efforts?
No, I think, with the COVID, obviously it's been hard. I've been trying to communicate this, but I think that what I'd like them to know, and hopefully they've heard, is that, the foundation is for everybody, not just everybody to give, but also to benefit from, so that we're hoping that we're reaching out to the communities. We want to help benefit patients and patient care and some of the research and education activities that we have. And I will be giving an update at this year's annual meeting in Tampa, so that people can understand some of these and some of the other initiatives that are coming for not only members but for patients and for our industry partners.
Well, I think I speak on behalf of all of our foundation, or all of our society, when I say thank you so much for all the work you're doing on the foundation, and all the things that it's going to do to help us in the future. For those who are listening from home, National Shoulder and Elbow Week is the third week of September, and this is going to be the inaugural first year, where we're going to be centered at 5 centers, and then it will grow from there. So you could contact the foundation to figure out how to get involved, or how to do this locally at your center with whatever flavor you'd like. Thank you to Dr. Miniaci for coming on the podcast and telling us about National Shoulder and Elbow Week and about his important work with the foundation. Anything else?
Yeah, so if I can put in one final plug,
please.
If our members would like to go and they don't know, like I said, there's 5 sites this year. It's at Tampa, Atlanta, Nashville, Philadelphia, and San Francisco. So even if it's not in their center and they'd like to donate this year, there's going to be a way, actually, just on your phone, you can text a donation in. You can find all of the information in September on the ASES website. And we look forward to having a successful year, so we can continue this in years to come, and hopefully coming to a community near you.
Great. So even if it's not in your community, you can still donate through the ASEF website. That's about all the time we have for our podcast. Thank you so much to Dr. Miniaci. For all of our Shoulder and Elbow listeners out there, don't forget to subscribe, and we will see you next time.
Thanks very much, Peter.